Staying healthy as we age is always a top priority for ourselves, and especially when we begin caring for an aging parent. That's why we're excited to have with us today Dr. Megumi Maguchi, who practices family and geriatric medicine with Baptist Medical Group. Dr. Maguchi is a Harvard-trained primary care physician with additional specialization in geriatric care, and she's here to tell us more about how to stay healthy as we age and share tips about being an informed caregiver. Thank you for being here.
Thank you for having me today.
Well, it's a very interesting combination, the being a family medicine physician, but also having the specialization. Tell us a little bit about how that came about and what that really means to a patient.
Well, the two combination is actually a very great thing to have. Geriatric medicine is the care for the elderly. Specifically, patients' population, the age would be 65 and older. And primary care that I have been trained as in residency time, we care for a population of all ages. And so when we combine the both together, you get to have a very, unique situation in which you know the whole family and able to care even better for the elderly.
So who would benefit from seeing someone like yourself? The elderly person or the person who you might notice that the caregiver's health is suffering because of caregiving? Who's the best patient, or is it all of them, as you said?
My doors are open for all generations, and it is actually both, because both have unique settings, different things and needs, particular needs that they need. Caring for the elderly in one aspect carries a lot of skills from the caregiver, and they would need advice as well as a care for themselves, and the elderly as well. And so they're very specific, tailored needs to individual families. They're never the same. That's the challenge. Every elderly is different. I remember in training time, they would tell me, when you know one elderly, you know one elderly. And
right,
so
right.
it is, that's the beauty of the whole scope of my practice, that it's tailored individually.
Well, for the family member, and you're exactly right, with the uniqueness of each individual, but in general, what are some things that we might look for to make sure we are healthy so that we can care for that aging parent? What are some advice you would give to the younger generation, maybe?
That's a great question. Especially the younger generations tend not to think about their health. They're caught up in their activities of daily living, and they're busy. They can carry a lot of worriness and problems, and they tend to neglect their own health just because the body can take it. And so in my practice, I tend to kind of remind them and set up goals, like doing exercise, eating healthy, taking care of their cholesterol. That is easily said, but how specifically can they do that? And so, as well as taking care of their elderly parent in a combination.
Yeah, all those things you mentioned are very easy to talk about. I talk about those with my doctor. I don't know that I do the best job, though. So how can we help then prepare our parents and make sure that they are aging in a healthy manner?
There's a variety of things that needs to be done. And it is pretty much a lot of things. As a younger generation, we would think this is the best thing. However, the elderly population is a little bit different. We need to go a little bit slower in what we think is the best thing. And together, with the healthcare professionals and the services out there, we can kind of tailor their needs. So it is a really individualized process when, the patient comes or the caregiver comes and says, I think this is great for my mom. We can always work it out in a way that it would suit the patient in a good way.
Do you ever design some goals for both generations to work on together so they have that support system, but also some accountability?
Absolutely, absolutely, and that's the main thing. The goals is the main thing. People carry or may not carry several comorbidities, several illnesses together. So definitely making goals, and then we meet again and we see if that is achievable or not.
Well, what would be we mentioned tips. What about the tips for the caregiver? What should we know as caregivers?
Well, you know, I have like a class that I like to give, first of all, to know what it feels like. And that's kind of hard, you know, when you're younger. How can you know what it feels like to be older? And so there's some, you know, tools and classes out there that I like to give, and it's really an eye-opener to see first, you know, what it would feel like to not have a very good vision or a very good hearing or pain in your joints and so forth. We do a little like simulated class that I like to give to the patients and families, so that they know, you know, what exactly it is like. And then from there, we would, you know, have a conversation as to what would be best.
We have caregiver support groups throughout our 2-county area, so we'd love to get you to come be a guest speaker one time.
That would be great.
Okay. Well, a lot of caregivers, you know, are concerned about dementia and Alzheimer's disease. What about these particular issues? What would you suggest, or what do you think is most important to know?
Dementia is a problem that is very concerning for a lot of people, and it is not, you know, everybody tends to worry a lot about it when you kind of have a little bit of a memory difficulty. Not every memory difficulty or every behavioral change is linked to dementia. Many are, but not everyone is. And so a proper diagnostic intervention is always important. It is a common thing as people get older, you know, to kind of have this worry, but properly intervening, you know, we can sort out what is the best way to do it.
Okay. Well, before we wrap up here, what would be your final word of advice to someone who's taking care of an aging parent?
Well, first of all is to know that there is help out there. There's a lot of resources out there, that they're not alone in changes, and when they feel that their parent or the grandparent need more help, or they're not sure what, you know, they just need more talking about it, my doors are always welcome, as well as the team, and
well, great.
To know that they're not alone.
Okay, well, that's very important for everyone to know. Well, thank you very much for being here, and that's great advice. We appreciate it.
Thank you very much.
We'll be right back with more Coming of Age and how you can help our local Meals on Wheels program win $1,000.